Today's question is from Elsa Nevis 1151, who writes, "My back teeth cannot touch. Have bad TMJ flare times 3 months. So what do you do when your back teeth don't touch? Wasn't mentioned. I have overbite. Since TMJ can't touch back teeth. Normally, yes, they can touch. So I had a few bad pops in right ear. Now TMJ much worse. So can't use these tips. Slight pressure front of ear, as doesn't work for this gal. Hoping to figure out, and what about slipped condyle disc?" Okay, thank you for the question. There are a few different topics in there with 2 separate questions. One about a posterior open bite and a second kind of ambiguous question about a slipped condyle disc. In this video, I'm going to talk about the first question. If people want to hear more about slipped discs and condyles, please mention that in the comments, and I'll get to it in a subsequent video. Before I talk about this topic, keep in mind that I can't possibly diagnose or treat anyone's specific TMJ condition through a video like this. Proper diagnosis always requires a hands-on physical examination and probably some type of imaging like a CT or an MRI. And just based on the way this post is written, and please correct me if I'm wrong, I would guess that an accurate and comprehensive diagnosis has not been made here, or at the very least, it hasn't been adequately communicated. What I can do in these videos is try to understand the questions that are being posed and then tell a story about what can happen to bring these types of conditions about based on my own experiences working with patients who have similar symptoms. So take everything that I'm saying here with a grain of salt. Don't just believe what I'm saying. Do some research on your own and try some things to see if they work, and then continually try to develop your own best understanding of the condition and workings of your own body. You are your best physician. Okay, now that that's out of the way, I'm going to address the first question in this video, which is, what do you do when your back teeth don't touch together? The first thing I would do is try to figure out why. When did you first notice this? Was it sudden or gradual? Did you have any type of injury? Do you have a history of clenching your teeth a lot? Does your jaw make any noises when you open and close? How long has it been doing this? Does it change based on whether you're standing up or sitting down? Is it different when you wake up in the morning compared to when you go to bed at night? These are just a few of the questions that need to be answered in order for me to have any idea about what to do if the back teeth don't touch, which incidentally is called a posterior open bite. In my experience, the 2 most common reasons for a posterior open bite to develop are tension in the lateral pterygoid muscles and arthritis in the jaw joints. So let's talk about number 1 first. The lateral pterygoids are the only muscles that can pull the mandibular condyles, the ball part of the jaw joint, forward and out of the socket. Tension can develop in these muscles from chronic protrusive parafunctional movement or long-standing forward posturing of the lower jaw. In other words, if you push or hold your lower jaw forward persistently with force, these muscles are going to become stronger and probably more tense. If these muscles are tight, it can start to feel like your back teeth don't touch together anymore, and only your front teeth come together during chewing. And this makes it difficult to chew effectively. Incidentally, this is what happens frequently when a person wears a mandibular advancement device, which is usually made for snoring or sleep apnea, because these devices hold the lower jaw in a forward position, and then significant parafunctional activity or clenching on top of that can happen during sleep while the jaw is in that position. The tension that develops in these muscles makes it feel like the back teeth don't come together when the person wakes up in the morning and takes out the device. Often we'll make something called an AM aligner, a morning aligner, to try to help patients get their normal bite back within a reasonable period of time, like just a couple of minutes, no more than 30 minutes though. There are 2 simple tests you could do to find out if muscle tension is what's causing your posterior open bite. First, I'm going to have you put your thumb and forefinger together like this on both hands, and then hold the front of your chin like so. Get your hands into a comfortable and stable position. Then you're going to push your jaw forward against very light force from your hands. Hold it there for a second or 2, and then allow your jaw to release and allow your hands to push your jaw back until it stops. You're going to do this 3 times in a row. And then with your hands still on your chin and your jaw muscles totally relaxed now, you're going to use your hands to tap your teeth together. Now, if your back teeth did touch together when you did that exercise, then it's likely you're dealing with a simple muscle tension problem involving your lateral pterygoid muscles. And you could repeat this exercise several times throughout the day until the problem feels like it's resolved. If you can't release your jaw, then it could be that these muscles are engaged in a protective reflex, trying to prevent the jaw condyles from seating into their sockets. And this could be an arthritis problem. And you need to examine some imaging if that's the case. Now the second test, and be very careful with this one if you have any kind of history of cervical spine problems or a lack of mobility in your neck. I'm going to have you look up with your jaw muscles relaxed, and you'll notice that your mouth is probably going to open a little bit when you do that. And that's because the jaw muscles under the chin are probably a little bit tight, and this is actually a good stretch for those muscles. So as you're looking up, start to close your teeth together slowly and gently, keeping the muscles relaxed. You're probably going to feel a stretch when you do this. I feel a stretch all the way down to the front of my chest when I do this. And it's exactly this tension that pulls the lower jaw back so that the balls go into the sockets if the lateral pterygoids are preventing this movement. To finish the exercise, allow your head to come back to a normal position, so you're looking straight forward again, and then gently tap your teeth together a few times. Now again, if your back teeth still don't touch after doing this a few times, then you need to get an exam and some imaging to find out structurally what's going on in your jaw joints. So now let's touch on the second most common reason for the development of a posterior open bite, arthritis. Usually with TMJ dysfunction, we see degenerative arthritic remodeling of the condyle, which shortens the height of the condyle and often leads to an anterior open bite. But sometimes the body responds to repeated traumatic injury or persistent overloading of these bony structures through progenerative remodeling, where we could see new additional layers of bone which have been added inside the jaw joint sockets. And this causes the jaw to be pushed forward. The best way to diagnose this is through a CT scan, which can be done at a lot of dental offices today. With this type of structural adaptation, no amount of exercise is going to change your bite. The only way we can get the back teeth to fit together again is to physically change the configuration of the jaw structures or the teeth. And that should never be done until stability over time has been observed and verified through the use of a permissive or sometimes directive orthotic device. Then the changes that need to be made can sometimes be done through occlusal equilibration if the open bite is just slight. And this can and should always be verified through a trial equilibration on models of the teeth before any reshaping is done on the actual teeth themselves. If the discrepancy is greater than a certain threshold, then the options include restorative dentistry, orthodontics, and surgery. And you'll have to find people you trust to work with you on this because each individual case is unique. Thank you for the question, and I hope that helps.